Hey everyone, my name is Adam Bowers and I'm the senior pastor at First Free Church in St. Louis, Missouri. Today I get to interview Dr. Doug Pogue. Dr. Pogue is a member of BJC Healthcare. He's a medical doctor. He's also part of our board at First Free Church. And recently, he's been put in charge of helping to coordinate where the doctors go as part of BJC Healthcare's hospital system to make sure that they are able to handle the influx of patients who have the new coronavirus. This is a very important interview, and I encourage you to watch the whole thing. We're going to talk about COVID-19, what it is, how you can protect yourself, some of the new information that has come out recently on it, what we are looking at as far as projections for the future. And he's also going to share what he would like to see Christians respond with for this pandemic. How can we respond in love to this? And from his perspective, what does he want our church to be known for in the middle of this? So here's my interview with Dr. Doug Pogue. So Dr. Pogue, thank you so much for joining with me right now to talk about the COVID-19 pandemic and what we are dealing with today. I want to start, if you would, by just giving us a little taste of your profession and your medical training and your involvement with everything that we're going through right now.
Sure. Well, nice to be with you today. So I came to St. Louis in 1991 and started medical school at Washington University and trained to be an internal medicine physician. So I do primary care as my specialty. Lynn, my wife, and I spent 4 years on the East Coast doing some medical work out there. And then we came back to St. Louis in 99, and we've been here ever since. And I've been in the West County community as a primary care doctor since then. For about the last 3 years, I've had a privilege of leading my group, and so I lead a medical group of about 600 physicians and nurse practitioners. We serve everybody around St. Louis, and then all out into the middle of the state of Missouri, and then into the southwestern portion of Illinois. So it's been fun. It's been gratifying for the people certainly that I've had the privilege of caring for over the last 20 years. In a time where there's a lot of challenges with healthcare, my new role gives me a chance to do strategy and to understand how the health care industry has to adapt and change a little bit to serve people in a different time, both with new technologies, but also with financial challenges that the country's facing and that healthcare is facing.
So you are right in the thick of this right now and being tasked with sort of strategically changing the way your hospital system is going to be able to handle COVID-19 patients. Are you seeing a huge influx of patients already, or is this just in preparation for things to come?
Yeah, we really are starting to see a change. You know, as I've shared with my physicians, this is the reason why the public invests so heavily in the healthcare industry, to train doctors and nurses and other folks that are really, really good at doing healthcare. During regular times, it's helpful, and it's good to have a good doctor and have someone who can guide you through and help you with challenges that happen. In times of a global pandemic, it's essential that the healthcare industry has to respond. Essentially, we are the counterattack to this virus, and we have to be ready to serve the public and come to their aid when people are in trouble. We are starting to see the first parts of the surge. I think for people who are keeping close track, it's the beginning part of where we think that peak will be. But our case rate, the rate at which new cases are being diagnosed and how fast that's climbing is not much different than New York City, where people have seen a lot of press over the last month about what's happening in New York. And unfortunately, the death rate here, in terms of the day-over-day increase in the number of people who die from COVID-19 here in the greater St. Louis region, is also on track to match what's happening in New York City. So there are definitely some surges and some concerning trends that are going on out there. We had last weekend our first hospital that had a surge in COVID-19 cases through their emergency department, which completely filled their intensive care unit. And they had to send out a distress signal for help because they didn't have the ability to care for anybody else who was coming in that night. We had to scramble to ensure everybody was in the right spot and had the right facilities and the right care setting. Thankfully, that was short-lived, but it was a shot across the bow that the surge is here, and it can happen any time in which there are too many people in one location, and we may struggle to serve them. One other hospital that I have in the network that I work with has almost a third of their entire patients in the whole hospital are COVID-19 patients. So when you think about just the size of our hospitals around greater St. Louis, for 30% of a single building to be nothing but COVID-19, that tells you the kind of caseload we're starting to see on the medical side.
Yeah, and obviously all of us who are watching this need to be praying for our healthcare professionals who are dealing with this, who are working long hours, coming in working extra shifts. We're seeing, some some major stories out of New York about this, but it sounds like with the way things are going, we may be experiencing that in St. Louis soon as well. Is this already putting a big strain on doctors and nurses?
It is. Folks that work in healthcare are just people too, and so we have the same fears, the same concerns about both our personal safety, but also the safety of our families. Many people in St. Louis grow up here and stay here. It's just one of the aspects of this community, and so often these family networks include folks over the age of 60, and so we have to be careful that our parents and grandparents don't become inadvertently affected from us. And pregnant women are also at high risk for this. So even in the 20s and 30s, it's very, very important that we steer clear of folks that are growing a baby, because it can be a real challenge for them to fight this off while pregnant, and it represents a real risk. So yeah, there are dangers. It puts a strain on everybody. We have a higher calling to do this, and particularly from a Christian perspective, as you think about just the unique creation and innate value that each person has. When we're serving God's kids in this fashion, it's a high calling. People are unique; they have God-given purpose, and if we can help them, if we can help change what happens to them, and impact the quality of their lives, or whether they'll survive this or not in some cases, then we have an obligation to do so. And so we do that. We put on a mask and we charge in, because that's what we're supposed to do. And I have a tremendous amount of respect for my colleagues that are in the middle of this, that are running respiratory care clinics where everybody's coming to see them, in the emergency rooms and the intensive care units, where they're doing the heavy work of caring for folks like this. It's inspiring to watch them come in with compassion and competence to try to help people, because we're all just people too, and I know everybody's stressed out about it and just as scared as the next person.
And we certainly thank them, and we'll be praying for them. I know that there is a large spectrum that exists as far as how seriously people are taking the COVID-19. And some people who are not respecting the restrictions at all. I just saw a news report this morning that in our county, they're going to start enforcing restrictions more because not everyone is following the guidelines. Some people think it's not a big deal. And of course, I get messages from people, some of whom are very concerned and have a lot of anxiety, some of whom don't feel like it's that big of a deal, and they're not really sure. And I know that there's got to be kind of a realistic perspective on this of how serious it is, but also how much people should panic, if they should at all, about this. Can you give us a sense as a doctor for how serious is COVID-19, and what should people's internal reaction to this be? Should they be afraid about this? Are we overreacting? Should they be more concerned, less concerned?
People need to take COVID-19 very seriously. I would not panic. Panic is not called for in this circumstance, but preparation and collective action are called for in this circumstance. So let me lay that out. So we know that for every person who gets influenza, they will pass that on to 1 to 1.2 other people as part of their illness process of people they come in contact with. Folks that end up with the new coronavirus will pass it on to 2.5 people. So the ability to catch something from a person who's sick or going through symptoms is a lot higher. It's virtually double that of what's happened with influenza and other infections that people are used to. At the same time, the hospitalization rate is much, much higher. We know that about 80% of folks that get COVID-19 will not need a hospital. They'll be able to fight that off at home, just having a cold or flu like they normally would. But about 20% of people will need a hospital to help them get through this. And 5% will actually need a ventilator or true life support in order to try to get through that. And even with all of that support, we know that 2 to 2.5% of folks die. If you look at the over 60 crowd of folks, almost 10 to 15% of them will die. Pregnant women, again, a high percentage of them will die relative to what we're used to in westernized medicine. So we do need to take it seriously. And so, and I would caution people in this. So if you are pregnant, if you've got a disease in which you take medications to try to stop your immune system from doing something like lupus, rheumatoid arthritis, Crohn's disease, or ulcerative colitis, medications like that, where you're on long-term therapy that affects your immune system as part of your treatment, or if you're over the age of 60, you need to be very careful. I mean, this is a danger to you. It is something that's a significant threat, and so you need to take steps to socially distance yourself from people, stay home, try to obtain services in the cleanest way possible. So, buy and cook your own food. Try not to get restaurant food or takeout that's prepared by somebody else. And when you do go to the store, utilize delivery options as much as you can. So you can call Walmart, Schnucks, other places like that, and give an order online, pay for it online, and literally drive up and just pick it up. You drive up, someone loads it into your car, you drive away. And so techniques like that can be used for people at high risk to minimize their exposure to other folks and to not, well, at least reduce substantially your chance of catching it. Now, if you're in those younger age groups, it's very tempting to say, hey, I'm 18, I'm 40, I'm whatever, and I'm healthy, I'm fine. Why would I need to worry about this? Well, you need to worry about it because if you are now a carrier, so if you get the virus and spread it to other people, either through a very mild infection or even a substantial infection that you know about, if you start spreading it through the community, the number of folks that are going to be sick and need a hospital will spike dramatically, and it will outstrip our ability to care for people. In the greater St. Louis metro area, there's about 2.2 million people who live in St. Louis City and County. When you start taking into account some other communities right around St. Louis, Belleville, Collinsville, Edwardsville, Alton on the Illinois side, all the way out into Wentzville, Troy, down to Farmington, and Sullivan down the Highway 44 corridor. If you take all of those in there, it's about 3 million people when you add all those up. If 20% of 3 million people need a hospital within the next 6 weeks, we can't help them. The greater St. Louis metro area, if you take all of the hospitals that we have, from any company, we've got about 7,900 or so hospital beds for the entire area. We've got about 450 or so ventilators at max capacity. And so, if 20% of a large amount of our population suddenly needs the hospital, we don't have the spots for them. And so if you're not in those high risk groups, you still have a responsibility to take this seriously, stay home, try not to connect with people for a little while, to allow this virus to kind of die out and get out of our community. And for goodness sake, if you're sick, if you realize you have a temperature or anything, stay away from people. Let that virus run its course with you and die out with you, and don't spread it to anybody else. You're doing a major service and a gift to the community and to your neighbors if you keep it inside the house if you happen to catch it, and don't let it out into our community.
Now, one of the things that you mentioned is a lethality rate or mortality rate of 2 to 2.5%, and there has been a lot of discussion about what that real lethality rate is. Does the 2 to 2.5% take into account all of the people who may be out there who are asymptomatic? Do we really know what the lethality rate is for everyone that contracts or has the virus in them versus just those that we're able to test and get reporting on? Any sense for what the real lethality rate of this may be, what we know at this point?
Yeah, I think it's evolving because there are areas of the world in which the communities were able to test aggressively and to have a closer sense of capturing everyone who may have caught the virus, versus in the U.S., obviously we've had tremendous trouble with the availability of tests, and there's a host of folks that have had COVID that have not ever gotten a test and will never get a test. So we're learning a lot from South Korea, who did aggressive testing. Singapore, some parts of Italy started to become more aggressive in their testing, and we're starting to pull some more data from Italy. And our data will evolve in the United States. We need rapid tests that come back within minutes, not days, and we need the availability of tests such that tens of millions of tests can be done, as opposed to the very minimalistic numbers that we see now. Certainly from a testing rate, we're only testing probably 10%, maybe 5% of cases that are actually occurring in the community. So certainly, as you see the numbers for the nation multiply by at least a factor of 5 to 10, because we're simply not able to test a whole host of folks. And the people who are mild, they never get tested because they just feel like they have a cold and they just get over it like everything else. So yeah, the real lethality rate, I think, was something that will end up understanding over time. Right now, the best we got is how many cases do we know we have, how many of them die, and so it's still a very distressing number, even with the numbers we have.
Yeah, absolutely. And I understand just today that information came out about Italy maybe not knowing exactly how many people have passed away from COVID-19 there, because a number of people have died from likely COVID-19, but they didn't get a test. And so not only are the cases underreported, but the deaths are also underreported. And from everything I'm seeing, it just makes it very hard to nail this thing down and really understand what exactly it's going to do as far as projections are concerned. But speaking of projections, one of the things that a lot of people are wondering about is what can we predict this will do over the summer? We tend to see cases of the flu go down over the summer. Is there any kind of seasonality, do we think, to COVID-19? Do we see this with the warm, moist air being lessened somehow in its ability to transmit to other people, or the severity of the cases?
Yeah, there's several different pieces of data I think that help us in this. So one is that if you look at other types of coronaviruses, and there's a number of them, they tend to go down in the summer months and surge in the winter months, much the way that influenza virus and other types of flus do. So people are looking at that as a hopeful sign that maybe this will do the same thing. At the same time, we see coronavirus spreading in warm climates as well. It's in terms of the United States, we're not seeing that this is ripping through the northern part of the United States and sparing, Florida, Texas, other warm areas, Southern California. It's spreading pretty quickly there too. So the temperature may not necessarily be a key definer for us, as much as the habits that we have in the summertime, where we tend to be outside much more and not gathered together inside as much, that people are still trying to figure it out. But certainly other coronaviruses typically behave as being down in the summer and up in the winter. The mathematical models that we have right now in terms of what we think we can predict is that a surge will happen and peak out in St. Louis approximately April 20th or so. There are some models that have it just a little bit earlier than that, a little bit of a faster curve here in St. Louis. And there's actually a major model from the University of Washington that actually is predicting St. Louis and Missouri will see their peak actually a little bit later into the early part of May. And then will last through the month of May and drop off. Virtually everyone's model has levels going to minimal amounts in terms of community spread by the time we get to the early part of June. So that's at least hopeful in terms of if we can flatten the curve enough that the healthcare systems can keep up with all the cases that do happen and make sure we take care of everybody who does come down with it and needs help. And then hopefully we only have to live through probably 2 months of this, maybe shorter, but 2 months or so. And if we can get to June 1st and have cases dramatically going down, then life can get back to normal.
Is there a chance, though, that we get to June and the cases are going down and we release some of the stay-at-home orders and then we find a surge again, and so we have to go back into it again?
Yes, that can certainly happen. So it is possible to have a double bump where essentially you see cases go up and then start to recede, and then the behaviors in the population change, causing those few cases that are remaining to now spread rapidly amongst those who are previously unaffected and to spike again. So it certainly is possible. I think we'll all have to resist the urge to break our self-imposed quarantine as we start to get to the end of this, because certainly as a public, we're not used to being quarantined like this or staying at home this much. It's already getting on people's nerves, and we may have 8 weeks to go. So as long as we can hold the quarantine long enough, then this virus will die out and we'll stop seeing kind of escalating spread. If we all decide to jump back too soon into our lives of regular kind of congregating and interacting with people in group settings, then we could see it spike back.
So what is your advice for those of us who want to make sure that we do not get COVID-19? Are there any helpful things that we can do? Maybe we're at home and we're following the stay-at-home orders, but we want to make sure that when packages come in or when we bring in groceries that we don't contract a virus from that. Or maybe we're one of the emergency services personnel or grocery store workers, truck drivers, delivery drivers, and we're extremely thankful for those people that continue to move our country forward and keep us safe by by putting themselves at risk in what they are doing. But for all of those people and for us, what can we actually do to try to keep ourselves from getting sick with a virus if we may come in contact with it through things that we touch or the air that we breathe, someone near us who has it?
Yeah, there's a number of things to do. I think what people don't need to do is go out and try to find an N95 super filtering mask and wear it around in their regular life. Generally speaking, most of us are not going to be within 6 feet of an actively contagious patient, unless you happen to have somebody in your home that is. Most of us are not going to encounter that if we're staying home and we're being careful about what we do. So we don't necessarily need to all run out and wear a mask all the time. There are cloth masks, though, that if you're going to the store, if you do have to run to the grocery store to pick up food and take things for your family, Joann Fabrics actually has a free pattern online that you can get, and you can sew those. I would encourage cotton for those masks rather than nylon. The nylon tends to have holes that are big enough that it doesn't help you as much. But certainly homemade masks can reduce some of the spread. The other things you can do, when you get packages, assume that those packages may be contaminated or exposed on the outside. When you think about the large factory settings that an Amazon or other major distributors will have, there's lots of people all working together 24 hours a day. And so the chance of spread, the chance of contagion inside those facilities is actually substantial. So take your packages accordingly and carefully remove the contents, discard the the outside box. And a lot of people, when they buy things, will wipe them down. They'll either utilize gloves and take the gloves off once they're done handling whatever the package is, or they wipe the packages down to kind of clean the surface before they handle them, particularly as you think about food.
And then they wash their hands right after they do that.
Absolutely true. Absolutely true. And the other thing I guess I would think about food in general is that if you imagine you're in another country, and often we find ourselves traveling and we really don't want to get infected or sick from the food or the water that is there in that country because our bodies aren't used to it. So what do? We tend to only drink filtered water or water that has been boiled. And we eat cooked food. We tend not to eat raw food. And so that's another way that people, if they're handling food and they're concerned that potentially I could have an issue, or what's the strategy? Cook your food and eat cooked food, and then from a water source standpoint, drink things that are relatively cleaned and or filtered. To our knowledge right now, St. Louis tap water is fine from this. We've not seen infection rates that we think are consistent with a public water source spread. So you can drink the tap water out of your sink if you want to. You can buy bottled water if you prefer that, or have a filtering system at home like Brita or some of the other filters that are there, and that's all fine too.
Yeah, one of the things we do in other countries is if we're going to buy something, we make sure that it's something that has a peel that we can take off so that we can eat the inside without having to cook it, but we take the peel off, wash our hands, then eat the food. I know a lot of people are opening their packages outside and just putting the box that it came in into the recycling bin or whatever they have, then bringing the package inside, wiping it down, washing their hands. And washing hands, it seems like, is one of the most effective defenses against this. So far, correct me if I'm wrong, but it seems like the primary means that people are being infected is by touching something with the virus, or a person with the virus, and touching their face, right? Their eyes, nose, mouth, something like that?
Yes, or touching the food and then consuming it. Absolutely true. Yes, regular soap and water is fine. Obviously, there's foaming hand soaps, there's hand sanitizer, there's some things like that. But I would encourage people, you don't need bleach solutions or other kind of caustic solutions in order to sterilize your hands. Regular soap and water done well, and particularly before you eat, immediately before you eat, so that you're not touching food with contaminated fingers, is essential to try to keep yourself well.
Now, you mentioned that a cotton mask that you could make at home might be useful to limit the spread of this. Can you explain that a little bit? Because for a while we've been hearing, don't bother with masks from certain sources. They don't really do any good unless you can fit them properly. But now I understand today that the CDC is planning to release new guidelines that do mention wearing masks as a possible way to limit the spread of the coronavirus. Why the change, and how are masks going to help us if they're just cotton and not an N95 medical mask?
So where you need N95 medical masks is areas in which the virus has been put into what I'll call high velocity aerosols. Think about spraying an old time Lysol can or something like that with a kind of fine particles under velocity that will come out in that. If a virus is in those very, very fine particles, like what happens when we do medical procedures in the hospital, nebulizer treatments for people who have asthma or maybe emphysema. There's some other situations that because of the misting aspect and things that we're doing in the lungs, you have very, very tiny droplets that will allow the virus to move into the respiratory system very efficiently. And so for those situations, you need a mask in which the filter is very, very small, where you really have a tight filter with only very, very tiny, tiny holes measured in the microns. And that allows those very, very small droplets to be blocked and prevented. Surgical masks, the regular masks that you'd see kind of on the street or that you'd see on a medical TV show, those masks are filter out to 3 microns. So they provide most of the protection that people need when they're just within 6 feet and working with someone. So if I'm going to be seeing a patient in an office and they might be just regularly coughing or sneezing or just breathing into the air that we're both sharing, a regular surgical mask is enough to keep me safe. We certainly learned from South Korea and from Hong Kong that when they put all of their medical caretakers, their healthcare workers who had direct contact with patients in the regular surgical mask, they had very low rates of those healthcare workers getting infected. So that was good data for us in terms of understanding just the value of a regular mask. Now, obviously, a cotton mask or multi-layered cotton that you'd buy from a fabric store does not filter at those levels. And so initially people said, hey, let's not do that because you're not going to get the filtering that you need to actually screen the virus out. But interestingly, what people have found in practice as we gather more data from communities is that the average size of the droplet, if I just simply cough or I happen to sneeze in a public place and maybe I didn't cover my mouth, those droplets are larger. They're kind of larger, coarser, and a lot of those droplets actually can be blocked by regular cotton masks. And you don't eliminate your risk of breathing in virus from those circumstances, but you do reduce it a little bit. And as the cotton basically takes a lot of those droplets, absorbs the water, which is why cotton's a little bit better than the nylon or rayons, and holds it in the mask. Now you can't and shouldn't use that mask for a long time. If you feel like somebody really blasted you when you're out at a store, finish what you're doing, take off the mask and don't use it again, or wash it in the washing machine such again that it's exposed to detergent before you would try to use it again. But there is some value to it. So if that helps people feel a little bit more comfortable and be able to get out and do what they've got to do, I think that's great. But certainly nobody should look at a mask like that's made at home and think of that as being somehow foolproof or absolute protection against possible infection. For instance, we talked about high-risk people a few minutes ago. If I had rheumatoid arthritis and was taking medication to control that rheumatoid arthritis, I should use a surgical mask. I wouldn't use a homemade mask because I'm at very high risk should I get infected. So that's an example. But if you're otherwise healthy and well, sometimes those masks can help a little bit.
So it seems like everything that we're talking about should be viewed as layers of reducing risk. Nothing is a silver bullet here, but you've got a homemade mask and then you've got a surgical mask, which is maybe a little bit better. You've got the N95 mask, which is better than that, but it has to be fitted properly or else it's not really much better than the other options because the air just goes right around. And then you've got washing fruit that you're taking in potentially. You've got taking boxes outside, bringing that in, all these things put together, social distancing, staying at home will hopefully reduce our risk enough to slow down the spread, basically so that we don't overwhelm the healthcare system, which is what you are working in. Is that all right?
Yeah, I think that's right. And there's just a huge benefit that we think so far is going to accumulate. We're starting to see it in some of the data, but it's a little early, to just not congregating together, to just not breathing the same air as everybody else in crowds. That seems to be doing most of the work. And so the rest of this stuff will be, taking you from 80% better all the way out to some extended percent of protection against the virus. But if just the basics goes a long way. So even if people are doing just those basics and then taking care with all the things you just mentioned, they stand a good chance to not pick this up.
So as a pastor and with a church to shepherd through this, I want to know, what are the right precautions for us to be taking as a ministry? Should we be eliminating all in-person gatherings, or should we limit those in-person gatherings by a certain number? Even once stay-at-home restrictions are not in place anymore and we're able to go out and about, do you recommend us keeping gatherings below a certain amount, or do we need to wait and see? Is there any risk in people having small groups meet in their home, for instance, once the stay-at-home restrictions are lifted, perhaps in a couple of months, like you say?
Right. I mean, I guess let me take some of the hypotheticals in stages. So right now, with where we are in this COVID outbreak, really all of us should not be getting together in groups unless we absolutely have to, whether that's part of the business and functioning of the church, or small groups and other kinds of community groups that are present within the church. We just need to try to stay separate for a while. And I would recommend that really across the board. If you have to do it, you have to do it, but if you don't. And so I think it's wise that the church went online for services, including things like junior high and senior high and other kinds of groups. If you have to meet in the smallest groups humanly possible. Everybody needs to have a strict code of honor that if they have any symptoms of any kind, they don't come. We can help each other along the way with this. But we've got enough technologies like the one we're speaking through now to try to connect and at least be able to see each other and talk together, pray together, and I think that's good. But let's try to keep separate as much as we can.
And I know there are a lot of people that are tempted right now to go ahead and just gather together in homes in little groups, and they're not necessarily following the stay-at-home guidelines, and they feel like maybe it's a bit of an overreaction. It sounds like your message to them is, hey, use the digital tools we have. Don't risk getting together and potentially spreading this before you even know if you have it.
Yeah, and we can love each other, and we can show each other how much we love each other without necessarily gathering in groups personally. It'll be great when we can again, and I guess my only advice at this point would be to wait and see really about how fast we can do this. I know we're all anxious. None of us like this thing where we're cooped up at home. Everyone's getting stir crazy. But at the same time, if we can be more diligent now, take this seriously, and give the community around us the gift of not accidentally spreading this virus and letting it go away faster for everybody, I think that's a tremendous gift. And we can bridge the divide with technology, with things that we say to people. The phones still work. We can call our neighbors, we can call our friends, we can talk to them, we can do things virtually. I heard of a community, a cul-de-sac, that did a kind of social event where everybody sat in their driveway on a camp chair and brought out a little food that they were going to eat, and they all waved to each other and talked to each other across the cul-de-sac. But they were probably 30 yards apart, let alone 6 feet apart, and in the outdoors, so they could talk together, but they were still quite separate, and nobody was sharing food or other things that would potentially create contamination. So there's creative ways we can figure out how to do this and still engage with everybody. Certainly, we are not all condemned to sit inside and watch Netflix for multiple hours a day. Don't do that to yourself. And for goodness sake, don't watch the news 24 hours a day. It will drive you crazy. But I think we can still extend connection. We can still extend fellowship and love out to both people in the church and people in our community. Without having to necessarily create the risk of getting together personally.
That's a great point. Stay at home doesn't mean always stay inside. And our neighborhood is constantly out and about now. We see more people out walking their dogs, walking with their kids, and there's a tremendous amount of neighborhood interaction, which is actually really neat. It's just we're trying to keep our distance from each other as we do it. But in some ways, I think that the neighbors can grow closer together through this, just because they're not going about their normal lives. They are kind of stuck at home, but they can get out, they can talk to each other at least from a distance. And we even had a parade here where everyone stayed in their cars and they all lined up and they went around and they honked their horns, and the kids all dressed up, and then they went back home, and it was a lot of fun. So there are lots of neat things that we can do to keep that community feel. And that's a positive kind of outcome of all of this. I'm curious if you have seen other kind of optimistic, positive outcomes that you see from this. What's some good news about the pandemic that we're in right now, the restrictions that we're in? Any good news even about the virus?
Yeah, so one good thing I think you just touched on a second ago, which is that it's forcing us to slow down. Our culture tends to run at a breakneck speed, and when every community becomes a bedroom community because we all work 16 hours a day, it's just not, it's not healthy for us. It's really not good. So this kind of forced slowdown where we have to maybe meet all of our neighbors now because we're out walking and we need something to do, and talking to folks is really fun when you don't get to do it very much. We're all around in our community. I think that's going to pay off some benefits for community connection and closeness and collaboration that'll be notable. I think we're all starting to look at how we do work And I think this forces a number of industries, certainly the healthcare industry is no exception to that, that maybe we can do a lot of the things that we do in a different way, fundamentally, than what we have been doing it. And it's forcing some change and some development that is going to be good. I think this virus being a little worse than other viruses is maybe forcing us to take seriously infections, and maybe, when we get to next fall and it's flu season's back again with us, I imagine some more people will get their influenza vaccines and take an opportunity to actually prevent a lot of these infections from coming in the community. And when we're sick, I'm hoping we treat ourselves better and we treat our neighbors and our coworkers better by staying home, and that businesses and other industries are more sensitive to that and more flexible with that, such that we do a good job both for individual people taking care of themselves and doing the right thing, and the businesses having policies which afford folks the opportunity to do the right thing as well. So hopefully, if this makes us better as a culture about how we handle infections in general and how we keep each other well, theoretically, that could be a good thing.
So people may not be aware that not only do you have your doctor hat and your medical administrator hat, but you also have an elder hat at our church. You're one of our elders. And if you put on your elder hat for a minute, what is your hope for our church family, the members of our church, attenders of our church, for how they will respond in the middle of this? What do you hope will be said of us as a church as we go through this together as a community?
Well, I hope people will say of us that we responded in love. I mean, when you think about this, the entire community is scared. They're frustrated, they're upset. Some people who have hourly employment jobs or other kinds of jobs that stop are facing financial stress and some other kinds of uncertainty in their lives. And we know because of our training and teaching that God's got this, and that this is going to work out, and we're going to be fine in the end. And don't miss the opportunity to extend love and grace and caring and compassion to the folks around you. That can start with your family and with your friends and people who are immediate to you. But again, I'm sure all of us live in neighborhoods where there are folks that are just kind of dying inside their house, not literally, but in the emotional sense, that they're very worried, very upset. This has really disrupted their lives. And a call from us could be a really good thing. In the past, Christians tend to show people they love them by bringing meals and things like that. I'm not sure I would do that right now. That may not be on the list right now, but certainly connecting from a verbal standpoint, from a neighborhood standpoint. Someone standing in their driveway and me standing on the sidewalk talking with them, that's pretty safe in the open air, and it's free, and we all have the time to do it. So I would challenge us, how do we respond and shine the good news of Christ, and how do we connect with our neighbors in a way that's practical, that's reassuring, that provides hope for them in a time when they're really, really stressed out. So in the end, I'm hoping that's from our group. I'm hoping that will be the mark of what we lead, and we don't miss the opportunity to do that. It would be a shame if we simply huddle up inside of our own homes with our Bibles and with our families. I mean, there's nothing wrong with that, but if that's all we do, if we simply focus on ourselves and our little community and don't shine that light outward and take the bowl off the light so it can be seen in our neighborhoods, then I think we've missed an opportunity.
Dr. Pogue, thank you so much for sharing all of your medical expertise with us, but also for sharing a Christian perspective of how our response should be to this and challenging us to respond in love. Just thank you so much for the time today.
Oh, you're very welcome. It's great to be with you.
Well, I so appreciate Dr. Pogue sharing all that information with us and his heart for people, that it's not just about dealing with the new coronavirus, but it's also about how we as followers of Jesus respond and interact with people. And that's what I want to leave you with today. I know that there are people in our church right now that are really involved in helping people in their neighborhood. They're picking up groceries for other people. Some of them are making masks for the hospitals that have asked for them. People are making phone calls to individuals who are struggling with anxiety and depression. And so there's a lot of care happening right now, but certainly there is more to be done. And so I want to encourage you that just because we are not meeting as a church right now does not mean we aren't still the church. We need to go and be the church. We need to be praying for our healthcare workers. We need to be praying for the truck drivers and delivery workers and people working in grocery stores and all the other essential services, emergency personnel, firefighters and police officers, and everyone who is at an increased risk because they are keeping those of us who are not not out there safe, and we're so thankful for those people. But we also need to be reaching out to our neighbors, getting to know them, maybe for the first time, finding out if there's anything we can do to help them and support them and get them through this. Remember that if you are a follower of Jesus, you have a hope that not everyone has. Now is a great time to share that hope with others. Go and be the church.